The emergency department is a unique place for older people. That particular point of interaction, we would of course all love to avoid an emergency department visit. Some are unavoidable. And given access to primary care, it sometimes is the front door and the way people access care. Unfortunately, emergency departments, like most of healthcare, is not designed for older people. It's not geriatric sensitive necessarily, certainly not for the needs of someone living with dementia. In our work in programs looking at prescribing practices for older patients who will be discharged from the emergency department, we do look at common reasons they attend to the emergency department and then the most common prescriptions. So something that may be very appropriate for a 40-year-old coming in with bronchitis, for example, really a little too much for an 80-year-old. And so what we see is often just a lack of geriatric sensitive prescribing. Sometimes that's a matter of a lower dose. So a steroid pack might be appropriate, but let's do a lower dose with a faster taper. There are some things that are part of what we call the Beers list, so those are potentially inappropriate medicines. And in the emergency department, as it turns out, time is of the essence. And one of the ways that we've been able to improve prescribing practices is by making it easier to do the right thing. So we've created order sets that have medications that are either more appropriate for that particular condition for older people or dosed for older people. And we made those the easiest and fastest order sets for that emergency physician or nurse practitioner who's looking to discharge this person home safely and avoid, of course, a repeat visit within the next few days.